clearly is a very serious epidemic. But equally, the fact that actually the great majority of people will not die from this. And I'll just repeat something I said right at the beginning, because I think it's worth reinforcing. Most people, a significant proportion of people will not get this virus at all, at any point in the epidemic, which is going to go on for a long period of time. Of those who do, some of them will get the virus without even knowing it. They will have the virus with no symptoms at all, asymptomatic carriage, and we know that happens. Of those who get symptoms, the great majority, probably 80%, will have a mild or moderate disease, might be bad enough for them to have to go to bed for a few days, not bad enough for them to have to go to the doctor. An unfortunate minority will have to go as far as hospital, but the majority of those will just need oxygen and will then leave hospital. And then a minority of those will end up having to go to severe and critical care, and some of those, sadly, will die. But that's a minority. It's 1% or possibly even less than 1% overall. And even in the highest risk group, this is significantly less than 20%, i.e. the great majority of people, even the very highest groups, if they catch this virus, will not die. And I've really wanted to make that point really clearly.
Do you know, for example, now how many people in the country have recovered from the virus and are now perfectly healthy again, such as the Prime Minister, for example?
Well, we have data. Obviously, you don't know everybody for the reasons Chris has said, because a large number of people have been asymptomatic or haven't gone to the doctor. But we do have recovery rates. They are available, and I see absolutely no reason why they shouldn't be made available.
Yes, we certainly have hospital recovery rates.
Yes, so we have, in a sense, what we have, and this is where I wouldn't want people to overread them, but it's important, they're perfectly open data, actually, it's perfectly possible to get hold of them if people want, is we have data on the people who got as far as hospital, how many of those left hospital. But of course, they're at the very severe end of the spectrum. All the ones I was talking about before that point, they make a full recovery, they don't enter the statistics. Now, they increasingly will enter the statistics now that we have a better testing capacity that means that we're picking out more of the milder cases in the community. But I think if people look at those, to go back to your point, what I wouldn't want is for people then to say, oh, well, that's and the mortality rate is higher than I expected. That's because the recovery rates we have are for people who are severe enough to get to hospital. And that's, even so, that is a majority. So it is important that in a sense it's read in that context.
Thanks very much, Tom.
Dr. Scott Atlas is a senior fellow at the Hoover Institution. We're happy to have him on tonight. Doctor, thanks for coming on. So let me just, leaving the political questions aside, bottom line it, given what we are learning about how easy it is to spread this virus between adults and about its actual death rate, what kind of response seems scientifically justifiable now?
Yes, and that's really the key question, is how to move forward. Well, it's actually good news that the virus spreads widely and without high risk to the vast majority of people. It's in fact, half the people are totally asymptomatic. Now, why is that good news? That's good news because that means that we have a better chance of developing population immunity. Instead of total lockdown going on, which prevents that, we have a chance to have people develop their own antibodies and eventually have enough people have these antibodies to block the sort of network of progression and contagion to the people who are vulnerable. That's exactly the same reason why we give widespread vaccines, to induce this so-called herd immunity. And by the way, that's exactly the same thinking about why it might be useful to take serum from people with antibodies who've had the virus and use it as a treatment or prevention to those who are vulnerable to the virus. We don't know for sure that antibodies that are produced are effective in giving immunity, but we expect it. It's consistent with decades of virology and immunology literature, and actually it would be unexpected if that didn't happen.
So the idea that the nation needs to remain frozen in place until a vaccine is developed, assess that recommendation, if you would.
Well, I think it's not just counterproductive as I just mentioned, it's actually harmful. It's harmful because we know, as you alluded to, massive healthcare that is critical has been skipped, avoided. About half of people with cancer who get chemotherapy have skipped their treatments. Roughly 80% of the brain surgery cases have been canceled. We're talking about people who have not only skipped critical care for acute stroke and acute heart attack, but in addition, all the biopsies for unsuspected and now undiscovered tumors have not occurred. We're talking thousands per week of those. And what's more so, and even ironic, is that people are skipping their children's vaccines. We are not only people have died and are dying, but we are creating a massive problem by not opening up healthcare with this single-minded policy of COVID-19 at all costs. And of course, the second part of it is we know how to protect the vulnerable here. It's not so simple, but we know who the vulnerable population is. And we know that as we go and let people mingle, like happened in the epicenter in New York, which is sort of, this goes back to what you said. Over 20% of people in Manhattan were discovered to have antibodies. And that's a good number. It would have even been higher if we would have had more social mingling, but we know that young people, young, healthier people, I don't see the logic in keeping them isolated.
Yes.
They're a vehicle to keep the transmission going to other lower risk groups and have population immunity develop.
It seems, for some reason, it is suddenly verboten to say any of that out loud. I'm glad that you did. Obviously, you have an informed perspective on this. Dr. Atlas, thank you very much.
Let me talk about
thanks for having me.
The issue of vaccines, because people have been touting that, oh, they need to develop vaccines to address this particular situation, and vaccines are important. If there are no vaccines, we are going to be helpless. The lockdown cannot be lifted. We cannot go back to economic activities. Well, personally, I don't believe in that sentiment. Vaccines have their place, but I have two major reasons why I personally don't think vaccine is the answer to COVID-19. Vaccine can be one of the options, quite all right. I'm not disputing that. It can be one of the options, but it is not the only option. That's number one. And number two, it is not even the most effective option. Why do I say so? First, all the viral infections that the world has ever experienced, how many of them have vaccines that is able to protect people sufficiently? Not one. People who get flu shots, we still have to keep getting it every year. This particular COVID-19 virus mutates very quickly. So even if you take a vaccine that is effective, tested and effective today, in 3 months' time, 6 months' time, another variant has come out and another vaccine will be needed for that particular one. That's number one. Number two reason why I think vaccines should not be the primary focus is that the current vaccine that they are trying to develop for this particular COVID-19 infection is not the typical vaccines that we are used to. The typical vaccines that we are used to, okay, they take a virus and weaken that virus and pump it into a person's body to stimulate an immune reaction so that the body develops antibodies against that weakened virus. So next time that person gets exposed to the real virus, the body already knows how to fight it. That is the principle of vaccination. But this particular vaccine that they are trying to develop is not that type of vaccine that we are used to. None like it has ever been developed in the whole world and used in humans. None. This is the first time they are trying to develop this type of vaccine. It is called the mRNA/DNA nucleic vaccine. That is the vaccine that they are developing now. mRNA/DNA nucleic vaccine. And that particular vaccine, this is what is happening. Okay, it has never been approved for human use as a new vaccine. Now, what they do is they take the genetic material of the virus, not a weakened virus now. They take the genes of the COVID-19 virus and inject it into the human body to fuse with your human gene. So that is, in my view, scientifically speaking, that is genetic modification. They are trying to create human GMOs, genetically modified organisms. This new type of vaccine, it has never been approved for human use. There was a trial that was done in veterinary animals, you know, to see how it works, and it was a disaster, and so it was banned. Now it is the same vaccine that is untested, that is about to be administered, and the worrisome part of it is that they are also striving to make it mandatory for everybody. If you don't get that vaccine, you can't get to certain places, you can't do certain things, you can't travel to certain places, you may not be able to get visas to certain countries, and all of those things. Now, the mandatoriness of that vaccination is a violation of our human rights.